and thank you very much for accepting the invitation and coming here all the way from various part of the city to learn and know more about one of the innovation we have. And today I'm very glad because we are sharing one of the innovation we have Abbott have developed for the benefits of the patient. And this innovation is related to one of the important tissue. Am I audible? I think yeah, right. Yeah. This innovation is related to one of the important key tissue of the body. Okay, and this tissue actually forms almost 70% of our weight within body mass, and that tissue is nothing but muscles. Okay, so as you all know, muscles are extremely important and they play a various role not only in having mobility, movements, or the balance of the body, but also has a functional role to play in various diseases or various conditions. Now, with this importance of this tissue, actually what happened in Indian scenario, if you really see, our childhood, all of us are almost on the same age. Our childhood actually goes in a little bit of exposure, the less exposure for the outdoor games. Then our diet is more mainly a carb predominant diet. We become young, we don't play much, we don't exercise much, but still then we get into our profession. Our professions are also now more predominantly a sitting or the sedentary professions, and this has a toll on the muscles. This definitely has a toll in the muscles, and definitely that's why actually if you really see in India, genetically we have poor muscles. On the top of it, we don't have an active lifestyle right from the childhood. And then there is our carb predominant diet, carbohydrate predominant diet, and the protein deficiency diet leads to a condition where actually we Indians have very poor muscle mass. So right from the beginning we have poor muscle mass and we don't develop it, and that's why when we aged up or Indians age up, the loss of muscle mass starts very early compared to the Western world. On the lighter note, you can really see the difference between me and Paul. So actually, he's very senior to me, but you can see the difference in the physical attributes. So that's what actually we Indians are. So what we do here is how to address this. Is we have various tools in our hand. We can definitely yeah, we can have more active lifestyle. We can incorporate exercise in our daily life. We can increase our proteins. Okay, there is a protein deficiency because if you really see, the muscles are the dynamic tissue of the body where on one side they preserve proteins, but when there is a protein deficiency they also supply proteins to the body. Okay, and this actually delicate balance is maintained when you are youth, but when you become age, the balance is tilted towards the protein loss or the muscle loss. So to address this, we definitely have a tool. We can be more active. We can incorporate exercise in our lifestyle. We can have proteins in our body. We can increase our protein intake, but with our diet and with our kind of culture, predominantly a vegan culture or the vegetarian culture, how much you can increase protein in our diet is definitely is a question mark. On the top of it, whether just increasing the protein will be helpful, whether we require essential amino acids or the different approach to build the muscle mass, and that's why here comes the innovation at hand. This innovation helps the protein in turn, it helps the muscle mass to build and also function normally. This innovation is HMB, hydroxymethyl butyrate, and this is a molecule which actually is developed from an essential amino acid called as leucine, and it definitely has an impact on the muscle in terms of building the muscles, building the muscle strength, and ultimately having an impact on the healthy lifestyle and other attributes. To know more about this molecule, we have Paul and Dr. Jayashree here, and I request Paul to take us through this molecule, its mechanism, its evidence, and how it will benefit all of us to have a healthy life and to live our life to the fullest. Yeah.
So thank you, and it's wonderful to be here. I'm really honored to be here, and before I came to India, I wanted to try to learn as much as I could about India and about some of the issues that may face Indians in everyday life in leading the healthiest and happiest lives they can, because that is truly my passion, trying to help people around the world use nutrition and exercise and simple things to help them lead better lives. And one of the things I learned, if I could have my slides, just for a moment, was pretty striking. My wife has lived outside of Chennai for many months doing yoga, and so knows a lot about India. And one of the things she taught me and that she learned while she was here is that 7 out of 10 people in India suffer from poor muscle health, from low muscle mass, from muscle weakness. I was really struck. These are the biggest numbers I've ever seen anywhere in the world that I've gone. And so I realized I think it's important that I come and talk about something that I really care about and I found helps many of my friends and patients and colleagues. And I learned some more. I read about some of the research that's been done in India, and 71% of Indians actually have low muscle mass and low protein in their body likely because of intake, and also because of diet, but a range of different things. And this is not just in older people, right? We know that as we age, we lose muscle mass, as we'll talk about, but young people, and I'm actually older than this group, I'm in my 50s, but even younger people in their 30s have significantly low muscle mass when it's measured. And this is from a study of thousands of Indians in many, many cities, as I'll show you. So this is a wide group of people in India, young people, including in Chennai. And interestingly, working professionals, people who perhaps are more educated even, who should know more about perhaps diet and exercise, seem to have worse muscle mass than those who aren't professionals. And again, this leads to all kinds of challenges, impaired muscle function, weakness, all kinds of challenges in everyday life, backaches, inability to play with your kids in the yard, or hold your grandchildren again, or walk down the street with the people you love in the way you'd like to. And these are the kinds of everyday things that we found people with low muscle mass can't do. And they looked at all the different cities this large study did in India, and they found even in Chennai and many, many other cities, again, there was very low muscle mass in almost all of the people from India they tested, especially relative to others, but in general, what we use as cutoffs for low muscle mass and risk of all kinds of things later in life, like illness. So why is this? And so I read some about what the Indian Dietetic Association, the people that study the diets of people in India across the country, they found that 84% of vegan diets are deficient in protein, which may not surprise you. It is something I think that we can work on, but actually almost 2/3, 2 out of every 3 people who eat a non-veg diet actually are protein deficient. So this is a wide variety. Almost all people across India are having these challenges no matter which diet they eat. And what they found is when they did surveys, these dietetic associations, they found that about 93% of the population didn't realize there were simple things they could do, simple things they could learn that could improve in natural ways their muscle mass, their strength, their ability to live a happier, healthier life. And so what I can read, having traveled the world and seen people from all over the world, but I think here more than anywhere else that I found that this is really an emergency in India, this low muscle mass. This is creating all kinds of challenges for people every day in their lives. And it's something I think that we can address, that we've learned how to address in other places, and I think we can do better. So how can we do that? Well, I think a few things need to be said first, too. The other problem is, not only are people 30 to 50 challenged by low muscle mass, but we know as we age, we lose significant amount of muscle mass every few years, especially as we get older. You can see, when you get over 40, it's 8% every 10 years. It's about 1% a year, and a 15% loss every few years, every 10 years after 70. So as people get older, muscle mass loss accelerates very rapidly. So this isn't just when we're young, but it gets much worse when we're older. It isn't just mass, it's strength. And so weakness begins to happen, and then the things you want to do every day, the things people want to do every day aren't able to be done. And so really this is an emergency, and we can be better. And I think we can do better, and I'm going to talk about that, and we're all going to talk about that today. Well, I don't think that we're going to convince the non-veg and the veg folks to change their entire diets. Because there was just a paper published actually that showed that the evolution of India's diet has evolved over about 11,000 years, since India went from a hunting society about 11,000 years ago to a farming society at that time. Actually, heights decreased and muscle strength and muscle mass decreased dramatically. They've been able to look historically at research, looking at different fossils and other things. So I don't think we're going to change people's whole diets overnight. But I think there's an easier way. And we've used this in other countries and other places to do the same thing. And now it's come to India as well, this opportunity. And so can we improve India's muscle mass and strength and people's quality of life more simply? And can we do it with something called HMB? And that's what we're going to talk about. HMB is a naturally occurring substance that works with our bodies to help our bodies use protein and make muscle in a natural, healthy way that we can benefit from, and now you can actually get in a drink here. So this is an everyday, common, active metabolite of different kinds of amino acids that we take in our diet anyway. It occurs naturally in things like avocados and watermelons and catfish, but you'd have to eat thousands of watermelons and hundreds of catfish at a time to get enough of this to do what it's supposed to do. It actually comes from the breakdown of other amino acids, and as we age, the amount of this really important amino acid goes down in our blood, and that's part of why we get weaker. And it's very safe, it's been studied in lots of studies, we'll talk about that. And so what this does is this works with the body naturally to help rebuild and maintain muscle so that it doesn't break down as quickly, so that people can be stronger, so that people can be healthier. It stops some of the muscle breakdown that happens naturally with aging, and it helps muscle build back up more naturally as we eat and as we exercise, or as even if we're just active every day. It allows the body to do what it's supposed to do. And again, you'd have to eat about 3,000 avocados or about 700 catfish to get enough, to get the same amount that you can get from a simple drink. And so again, no one's going to eat this much to do that, but this allows us to get a naturally occurring substance, something that's natural our body can work with every day. It's been studied in hundreds of studies. I can tell you I've been taking it since 1996 myself. That's when it became available in the US. I was encouraged to take it by athletes and other really people I looked up to that were really healthy when I was younger. You wouldn't know it, but just a few months ago I had a major abdominal operation. I was in the hospital for almost 3 months. And if it wasn't for this, you wouldn't know looking at me probably, is what most people tell me, but it's because of, I take supplements like this every day, and this allows me to recover and live my life actively and dance with my wife and do the things I want to do. It decreases some of the inflammation that our body sees from just aging and stress. Athletes have been taking it for many years. It was developed for athletes to gain muscle mass without gaining fat mass. Everyone's dream, right? But it actually does that. It's actually been proven to do that. And it doesn't have any side effects. People have taken it for over a year. I've taken it for, gosh, almost 30 years now. And I don't think anything's gone too badly yet. So there's a lot of research, a lot of trials, like I said, over 100 trials, 30 years of research. I've been taking it for almost 30 years myself, and I know many, many people, and many of my patients that take it as well. And so there's lots of research in thousands of patients. And these are just some of the examples. So this was a study of elderly women, 80 elderly women who took an H&B containing drink, or a placebo basically, or a drink that didn't have H&B in it, and it looked at their strength and walking ability and other things. And one thing they found was the people that got the H&B drink, or the oral supplement, had more muscle mass, more muscle density. They had better muscle strength, even in the elderly women, very quickly. They also were able to walk faster and further. When we do a lot of tests where we have people walk for 6 minutes and we measure how far they walk. I do with lots of my patients. And this is a standard test, and the people who took this were able to walk further and longer and better. And there have been lots of studies. This is another study that looked at how strong their hand grip strength was and found their hand grip strength was better, their ability to walk further was better, their ability to be stronger, the strength of their muscles was better. So even in the quite elderly folks, this helps a lot. And then there's large groups of studies. So these are meta-analyses or reviews or studies where they look at all the studies and they put them together to see how it helps people, and this is at muscle mass. And if you look at all the studies in many, many, many patients, again, or many, many people, these actually aren't patients, these are regular people like you and me, it improves muscle strength and muscle mass. So again, this is a big issue in India, and something I've learned a lot about in the last few weeks as I've prepared to come here. And I'm really excited, and that's one of the reasons I flew all the way here, was to tell you about this, because again, this is a big problem, and as people age and as people begin to not be able to do the things they want to do, this is going to become a bigger and bigger problem. And so we can do better. And so I don't think we're going to change all of India's diet after 11,000 years in the next few months to a few years, but I do think simple things like this can be an easier way. And using H&B, this new supplement, is something we can do naturally to help people, help them improve what they need to do. And these oral drinks are now available here. And again, many of my friends and I have been taking them for many years in the US, but I think it's exciting they're finally available here. And then I think if that combined with a little exercise, people can really lead their best life here in India and really have the best opportunity to do the things they want to do, walk down the street with the people they love, and hold their kids and grandkids the way they want to do it. And with that, I'll leave you with this, and I look forward to hearing more of your questions and hearing the rest of our presentation. Thank you.
especially from the muscle mass and muscle strength point of view. It has a relevance, it has a clinical evidence which shows that it actually protects the muscles, it builds the muscles as well as it protects the muscles. It actually prevents its muscle breakdown, especially in the elderly where the problem is more severe, because on one side you have protein deficiency, on the other side is a muscle breakdown. So it definitely it's important from that. But coming to the Indian context and or the Indian young people, young generation point of view or the middle age point of view, I would like to ask or hear from Dr. Jayashri how it will help or it may help in Indian context, especially younger generation having a sedentary work styles and also have a bad dietary habits, and whether it will have an impact or it will help in this kind of population. What is it?
Thank you. Good morning, வணக்கம். தமிழில் பேசலாமா இங்கிலீஷில் பேசுவா? சரி. Anyway, either. Just switch. So first of all, thank you to Dr. Paul for enlightening us and pointing out our state of emergency. I think all of you know that the World Health Organization has said that 70% of all diseases that humans face are lifestyle related. So things like diabetes, heart disease, heart attack, stroke, we all daily நம்ம பார்க்குறோம் இல்லையா பேப்பரில், somebody at the age of 45 getting a heart attack, someone at the age of 42 getting a heart attack. So a lot of, and diabetes of course எல்லாருக்கும் தெரியும், it is rampant, but a lot of the diseases of old age, whether we talk about diabetes, heart disease, dementia, blood pressure, அதோட மூல காரணம், when does it start happening at your ages, younger than you actually I would say. At ages of 20, 30, that is when the roots start being spread for all of these, what are called non-communicable diseases. What is alarming about non-communicable diseases is 70% is preventable. All of you sitting here like this, all of you are at risk of developing may already have, I do not know, any one of these diseases. So, prevent pannadhukku one of the most important things is exercise, physical activity and maintaining our muscle mass. And like Dr. Ganesh said, this has to start at a young age. Dr. Paul shared data showing how the muscle mass starts coming down after the age of 30 or 40, which means at the age of 20 we need to have maximum muscle mass. It's like a bank balance. You need to have good amount of muscle, you need to have good amount of bones, you need to have good health as much as possible when you're 20, 25 years old, because after that sadly it is all downhill. How do we get to optimal muscle mass between the ages of 20 to 30? So, I mean, I'm only talking about muscle mass today, but everything else now, it has to reach a maximum at that age, between 20 to 30 years. One of the ways we improve our muscle mass is with exercise, physical activity. Okay? If you see a child, they keep running around all the time, they never sit still. Okay? As adults, we keep sitting still. I think you would have all heard this phrase, sitting is the new smoking. So sitting for about 1 hour is equivalent to smoking, I don't know what, like half a cigarette. Some numbers will come up, but sitting is bad. So we have to get up and keep moving around. That is very important for our muscles. We don't realize how weak we become. I will tell you one simple test you can do. How many times can you get up and sit down within 30 seconds? Very simple test, on a chair without holding a thing. How many times can you get up and sit down? People who are very weak, older people who are very weak, find that even getting up and sitting down minimum is 5 times in 30 seconds. People who are very old and who have muscle weakness, particularly weakness around the hip muscles, weakness around the back muscles, they are not able to get up and sit down. What is alarming is we find younger people, we are finding children who are weak, we are finding young people in the 20s and 30s who are weak like this with muscle weakness. So, the way to build it up is first of all awareness, understanding that all of us suffer from muscle weakness, muscle loss, unless we are born with good muscles but we don't take care of it. Second, apart from awareness is physical activity, exercise. Even simple exercises like sitting on the floor and getting up is good exercise for us. Climbing up the stairs, sitting on the floor, that is very good exercise. If you do that 10 times a day, I think all of you know, we do what is called this Topikarnam, okay? Topikarnam border is very good exercise. You may not, I don't know if you know, we sort of, hold our ears and we go all the way down and we get up, okay? That's like a colloquial Tamil term that we use. But doing that 10 times a day is good exercise for your muscles. Number 3, like Dr. Paul said, our diet is very, very poor in protein. Where do vegetarians get proteins from? We get it from milk, we get it from dal, paripu. Those are the only two sources of protein. We don't eat much by way of dals, we don't drink much by way of milk or consume curd or buttermilk. We don't get enough protein. So we have to consider taking more protein in the diet, whether we do it through adding supplements like this. HMB is a very important supplement. There are several other supplements. HMB is one of the most important supplements to help building up protein. So this is to create awareness about it, but I think the more important message that needs to go out is that, I think as correctly said in the keyword here, muscle matters. So muscles are very important and we have to take time to understand and improve. For example, men also suffer from fractures at a very young age. Part of the reason why they suffer from fractures is because of poor quality bones and muscles, which is because of poor protein intake. So make sure that first of all we need to create awareness, work on building up our muscle strength and work to increase protein intake using supplements like this. I'll stop here and happy to answer questions.
Thank you.
Something else I came across that. Not only are we vegetarians, 80 to 90% of our diet is carbohydrate. 80 to 90%, which means only about 10% is protein and less than 10% is fat. Ideally, we need to have at least about 30% of our diet from protein. So starting from a young age, the fact that we are born with relatively lesser muscle, that may also be because of the fact that your mother had less protein intake to begin with. So then there is this concept of what is called epigenetics. What is the health of your mother and father when the baby is formed? So at that point in time, if the mother and the father themselves have less protein, then you're born and from a young age, relatively we are all consuming less protein and working out less. Diet plays an extraordinarily important role. So that is why, for example, people who can have eggs, I think you'll know in Tamil Nadu, in the new meal scheme, some areas they started giving an egg to improve the protein intake because that is so important for us. We have very little protein intake in our diet, and one thing we need to keep in mind is protein intake is not linked to just calorie deficit. People who have enough and more calories, so it has nothing to do with the with sort of the class, and people who are necessarily eating more do not have more protein intake. All they are having is more calories, more sugar and more carbohydrate. Maybe more fat, but not more protein. So generally, as a rule, our protein intake, overall studies have clearly shown, is very poor starting from a young age.
In the sense, do you mean to say that people who consume non-vegetarian diet will have access to more protein and the converse is not true? That is
that doesn't hold true in India again. Even though we say non-vegetarian in India, most people in India, when they say they eat non-vegetarian food, they are talking about having fish or chicken or mutton maybe once a week. And maybe eggs once a week or twice a week. That doesn't really count as non-vegetarian. So studies again have clearly shown that there isn't much difference in terms of protein intake, whether you call yourself a vegetarian or a non-vegetarian. That is why this protein supplement is necessary even among vegetarians and non-vegetarians, at least in India. List. Number one is the most radical, so I'll get it out of the way. Stop selling sugar in ration shops. Okay? I think sugar should become a luxury item. We don't need sugar to live. Sugar is a luxury item, so I don't think, anyway, that's the most radical. Second, every day 1 hour should be set aside in schools for physical activity. Unfortunately, there is only 1 hour every week, which is also taken over in the higher classes for studying for exams. 1 hour every day has to be set aside for physical activity, not just for students, but also for teachers. Everybody needs that physical activity. We don't emphasize it enough. Number 3, Tamil Nadu government has done a wonderful job of putting that noon meal scheme for nutrition. We should include more protein. I would like to take 2 minutes to share a small scheme we did in a small village near Tamil Nadu. We gave a protein-based drink to children, vegetarian. We didn't want to give eggs, so it was called the kanji scheme. So we'd taken children in the school and we gave them a kanji, we gave them a protein mix, so that included like millets, it included corn. So we came up with a mixture, and that kanji mix, at the end when the children were going home from school, they gave them 1 tumbler of that kanji mix to drink. Just basically, improving their protein intake. We did a study among these school children before we implemented the kanji mix, and one year later, and we were astonished. 1 year before we implemented this kanji mix scheme, 50% of the children were coming in with, running noses, they had skin sores. 1 year after, we saw one child with a skin sore and one child who had a thing out of about 200 kids. It was a small village school. Most amazing thing we found was the parents who came and told us, teachers who came and told us, the children had more energy to fight. There were more fights, but they had more energy to fight. Such a simple thing. All we did was we gave this kanji, 1 tumbler of kanji in addition to their noon meal scheme. We also had to get permission from the block development officer because we were doing it through the government schools. The scheme is still going on in small villages over there, but just to say that this supplementation of this little protein intake improved the children's lives so much. So improving protein, setting aside time for physical activity, I think are 2 very important things that can be implemented easily.
Will you take up this one to the government to expand all over Tamil Nadu?
I would love to. Maybe I will. Thank you.
Okay.
Any other question?
I have a question.
What?
Patients is just to use a